Hello and welcome to another Rush Generations lecture, health education lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, October 23rd, 2024. I am Franco Samadaro, and I'm the program coordinator for the Shulman Senior Voices. I'll be your moderator for today's lecture, Oral Health. Before I present to you our wonderful speakers joining us today, I'd like to first thank Hannah Weinsman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we can all have a great discussion about oral health. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which allows us to host a good number of people who join us via phone as well. Thank you for joining us. For those on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenters. As for those of you joining us and listening via phone, you will have an opportunity at the end to unmute your audio and so that you can ask your questions. We'd like to remind you that all information offered here is for general informational purposes and always seek additional professional advice for situations specific to you and your needs. Welcome again. Without further ado, I'd like to introduce Denise Namick. Denise is a fourth-year dental student at University of Illinois at Chicago and a current Schweitzer Fellow. As the oldest daughter of Iraqi Turkmen refugees, she brings a unique perspective to her work on improving oral health access, particularly among refugee, immigrant, and underserved communities. Currently, she is completing her Schweitzer project with Refugee One, focusing on decreasing oral health care disparities for refugees and asylum seekers in Chicago. Welcome, Denise. Our other presenter today will be Hussein Salem. Hussein is a third-year dental student at UIC College of Dentistry and a Schweitzer Fellow. He is passionate about public health and dentistry, focusing on education about preventative care and providing free dental services to underserved populations. Through his work, Hussein aims to promote oral health awareness and reduce disparities in access to dental care. Welcome you both, and thank you.
Thank you so much, Franco and Hannah. I really appreciate it. Appreciate all your help on this. Thank you for all the listeners and watchers. We really appreciate you guys being here. So the discussion for today, we're going to be talking about oral health in general. And then we'll specifically go over 5 different topics. Let me put my camera off. Oh, you guys can see me good? Okay. So we'll go over 5 different topics. So if you could go to the next slide, please, Hannah. So the 5 topics we'll discuss today, one being common misconceptions about dentistry and oral health in general. Second point, we'll be talking about how to brush and floss the proper way. So most Americans don't brush and floss the proper way, so I'll be going over that. Third topic is how to take care of your dentures and partials. Fourth will be why you should go to the dentist every 6 months. And this is a really important topic that I really want to go in depth on. Fifth topic is nutrition and its impact on your oral health, and as well as your overall health as well. We'll discuss that a bit. So common misconceptions about dentistry. So one being, you only need to see the dentist if something hurts. So a lot of patients come to me when they're only in pain, and you know, once you're already at that stage, it will usually cost more, it's more invasive. And so I really want to stress the preventative aspect of dentistry. It's much more cost effective and it prevents, bigger issues from happening. So you should go to the dentist for preventative care. Also, obviously, if you're in pain, you do want to seek a dentist, but you want to seek a dentist also for the preventative aspect of it. Second, sugar is the only cause of cavities. So while sugar does, potentially could cause cavity or caries, as we say in dentistry, There's other things that are that could cause cavities. It's very multifactorial. So it could sometimes it could be a dry mouth. We also another name for dry mouth is xerostomia. So that could potentially cause cavities. Sometimes it could be genetics. Another, it could be how you're brushing. If you're brushing really hard, that could cause cavitations. And you can kind of see on the picture right here, the picture that says abfraction. So you can see that cavitation, that's caused from brushing really hard. And it kind of goes to my third bullet point. So brushing harder cleans better. So that is actually not true at all. So brushing harder actually could cause more damage than good. When you brush hard, what you do is you could potentially wear out the enamel. So kind of like how you see in the bottom picture, the one labeled abfraction, you could see the enamel has worn out due to brushing hard. And then also the top picture, you see gum recession. So brushing hard could cause your gums to recede, and that could cause sensitivity and even pain. So you don't want to brush hard. The idea is to brush very gentle with a soft bristle toothbrush. The fourth bullet point being you will lose your teeth as you age. So this is not always true. A lot of people think that they're bound to lose their teeth as they get older. I have patients that are in their 80s and they have all full set of their teeth. So it's really like how well you take care of your teeth. If you have good oral hygiene and go to the dentist every 6 months, your teeth could last you, your entire life. So that's a big misconception. Fifth bullet point, flossing isn't necessary if you brush well. So this is a big problem that we have with a lot of patients. They'll come in and they're brushing, but the flossing, and they really think, oh, it's not that important. But what it is when you're brushing, you're cleaning out the front side of your teeth and then the inner side. But in between the teeth is what the brush doesn't really get into. And so that's where the floss comes in. And so it's really important to floss to prevent cavities in between your teeth, as well as plaque buildup. And actually, most of the plaque buildup and cavities that we see in patients are usually in between the teeth. And that's all due to patients not flossing. And so it definitely should be a part of your routine, your oral hygiene routine to floss. And we'll discuss that in detail, the proper ways to floss later on. Next bullet point is gum disease is only a concern for your mouth. So that's actually a big misconception. A lot of times, so our mouth, our oral health is tied to our entire body and, our overall health. And so systemic conditions like diabetes, uncontrolled hypertension, like high blood pressure, it could also affect your gum health and can contribute to gum disease. And then the last bullet point, toothaches are no cause for worry if they stop. So that is a big no-no. So if you are getting severe dental pain and it's keeping you up at night, you're getting this throbbing, really bad pain for like days, and then it goes away, that is not a good sign. I've had patients that come in and say, oh, it was, I had the worst pain. It was like keeping me up at night for like a week, but then it went away, so I'm all good. So what happens is when your tooth is severely inflamed, it's something called pulpitis, so an inflammation of the pulp tissue. And that is when the patient is in a lot of pain. Over time, the pulp gets inflamed so much that it eventually kills the nerve and it becomes necrotic. So basically the nerve is dead. And at that stage, it's infected. And so you're not feeling the pain anymore because the nerve is dead and it's infected. And if you leave that sit, the infection can get larger and it could eventually, travel. And so if you have a really bad toothache and it stops, that is not a good sign. You need to go to the dentist as soon as possible. All right, we'll go to the next one. So oral hygiene. So why is oral hygiene important? So it prevents tooth decay, cavities. It could avoid gum disease. And if you already do have gum disease, it could potentially stop it. And then it could prevent tooth loss, freshen your breath, of course. And then we kind of mentioned the avoid cavities. And then you want to maintain a great smile. Having a good smile, it increases people's self-esteem. And it's, like I mentioned earlier, our teeth and our oral health is tied to our overall health. And so if your teeth and oral health are not healthy, it'll translate to your overall health as well. So you want to maintain a great and healthy smile. And then we'll go to the next one. So for this, how to brush and floss the proper way. So I'll go over the brushing. So this technique, it's called the sulcular brushing technique. It's also called the Bass brushing technique. And so the idea is, like I mentioned earlier, you want to use a soft bristle toothbrush. So a medium or a hard coarse bristle toothbrush is not recommended because it will cause your enamel to wear out. Enamel is the first layer of your teeth. It'll cause that to wear out, and then it could cause gum recession, like I mentioned earlier. And so what you want to do is get a soft bristle toothbrush, and the positioning of the toothbrush is very, very important. So you want to position it at a 45-degree angle. So kind of in the interface between your gums and your teeth. So where your gum and teeth meet. So you can kind of see in the picture right here, the bristles are pointed towards where your gum and your teeth meet, and that's at a 45-degree angle. So once you have the position down, you want to brush very gently. So brushing hard will cause more damage, like I mentioned earlier. And so you want to do very gentle, short brushing strokes. You could also do like small circular motions. That's also fine. And then once you are done brushing one area, you want to move to the next set of teeth. Once you're done with the front side of the teeth, you want to go on the inner side. And then once you're done with the inner side, you want to do the chewing surfaces of your teeth as well. That's a common area where we see a lot of cavities. So you want to brush there as well. And then a big one is you don't want to forget to brush your tongue. So a lot of patients that come with bad breath, we also call it halitosis. A lot of times it comes from our breath or from our tongue, I'm sorry. So our tongue harbors a lot of bacteria. And so brushing your tongue is very, very important. And you could also get like something called like a tongue scraper. They have them like in a lot of like, Walgreens, CVS, you could purchase them there. But when you are using a tongue scraper, it's very important that you want to apply a lot of pressure because that could cause the papillas on your tongue to wear out and it could cause more damage. So you could use that as like an adjunct tool, but you also then want to make sure you're brushing as well around your tongue. And then we'll go to the next slide. So for the flossing technique, so it's called the C-shaped flossing technique. I'll kind of go based off the pictures. So what you want to do is get like an arm's length of floss, and then you're going to wrap the floss around your two middle fingers. So kind of how you see it in image 1. So once the floss is wrapped around your two middle fingers, you're going to use your index finger and your thumb to floss. You get a really like a good grip with your index finger and thumb. Once you have that, you're going to position it like how you have in the second image. And then you're going to want to gently go in between the teeth. So kind of how you see in the third image, you don't want to go too hard because that could potentially lacerate your gums and it could cause, some damage. So you want to gently floss in between your teeth. Once it's in between your teeth, like you see in image 3, you want to adapt the floss. So make a C shape. So kind of how you see in image 4 as well. So the person's doing a C shape around the tooth. And then you're going to want to go up and down around 6 times. Once you're done with that side of the tooth, you're going to go to the adjacent tooth, the tooth right next to it. And you'll do the exact same thing. Gently go up and down one like 6 times. Then you'll take it out. And then you'll wrap that side on the left middle finger. And then you'll get a new set and do the same thing. So the idea is you don't want to be just snapping it in and out. You want to make sure that you're gently putting it in between your teeth, adapting it very nicely, and then doing like around 6 strokes. And a lot of patients come in, they use the pick flosses. With those, I personally don't recommend just because they're usually very straight and flat and they don't really adapt well to the tooth. And so you're not really getting a lot of that bacteria and plaque out. And so I really, really recommend the string floss because it really adapts well to your teeth. A lot of patients also use something called like a water pick, which is like a device where they kind of it's supposed to be like a flosser built with water. It's a really good adjunct, but I don't think it replaces the string floss. So the string floss is like the gold standard. So you want to make sure you're using the string floss. And then if you really like the water pick, you could use that as an extra, but you don't want to replace this completely with the string floss. You don't want to replace the string floss with the water pick. All right. And then we'll go to the next one. So the rule that I want it to be ingrained in your minds is the 2-2-2 rule. So what is it? So you want to brush your teeth twice a day, and then you want to brush your teeth for 2 minutes, and then visit the dentist twice a year. And so with brushing for 2 minutes, a lot of patients that have electric toothbrushes, which I highly recommend, they a lot of times have the 2-minute timer built in. So you could brush and it'll, while you're brushing with your electric toothbrush, it'll stop automatically at 2 minutes. So minimum you want to brush for at least 2 minutes. You could do more than that. That's completely fine. But 2 minutes is the minimum that you want to reach. So the 2-2-2 rule. So you want to brush for 2 times a day, brush for 2 minutes, and then visit the dentist twice a year. And so for the third bullet point, how to take care of your dentures. And then I'll have Denise kind of come in for this one.
Cool. Thank you, Hussein. So in terms of dentures, a lot of the times that so the first thing that I always make sure when I'm talking with denture patients, like let's say I'm making a denture or they're about to get a denture, is really understanding the concept that a denture is essentially a foreign object according to your body. So a lot of the times it takes quite some time. I think it depends on the person, but I would say it takes at least 1 to 2 months for someone to get used to wearing a denture, but also making sure that it fits right in the mouth, but that it's something that that patient gets used to. So once that is kind of there, established, there are some ways that we need to make sure that we can take care of the denture so that we don't run into issues of the denture not fitting in properly, or even worse, kind of potentially causing infections. So the one rule for the denture is not to wear them overnight. Again, a denture is a removable part. So when you're asleep, depending on how retentive the denture is in the mouth, we don't want that to be a risk for hazard for choking. So that needs to be taken out when not in use, or overnight when you're sleeping. When you do take the dentures out, it is made of acrylic. So the way that the way that we make sure that the acrylic lasts for a long period of time is by making sure it's not left to dry. Because when a denture is in your mouth, you have saliva and natural processes that keep the denture moist. But when it's out of your mouth, it can dry up really quickly, and that can cause it to weaken in structure, which would lead for it to break down the line. So whenever you're not wearing the denture, always store them in some sort of liquid. Water is completely a-okay. Sometimes I know over the counter there's different things like, cleansing tablets and other things for dentures that you can mix with water and keep the denture in there overnight. That's totally fine too. But when in doubt, water is completely fine. The other thing is this denture, it is made of a hard material. So when you have regular teeth, as Hussein was talking about before, very important that you use a soft bristled toothbrush. But because a denture is not real teeth, it's not real gum, and it's hard, I know, almost like, it's not plastic, but it kind of feels like plastic. You want to make sure that the toothbrush that you use to clean it off is stiff. And this is because the food, whatever you eat, can really, really get stuck on the acrylic itself in between the teeth. And so if you were to use a soft bristled toothbrush, you would just have to put a lot more pressure. And sometimes, especially in, older patients where mobility, motor skills start to get a little weak, it can be a little difficult. So when in doubt, always go with a stiff bristled toothbrush. And make sure that you're brushing the teeth and just the outer part as if you were brushing your teeth, as well as the inside. And this is in the picture in the bottom right corner. You can see that there's a toothbrush on the inside of the denture. That area is also really, really important to clean out, especially if you use adhesive. Sometimes when a patient or when someone has a denture, it doesn't sit, or it's not retentive all the way. So you can get like over the counter denture adhesive to just lightly place on the inside. So after you use your denture at the end of the day, you want to make sure that you're really cleaning out that adhesive and making sure there's no residue left behind. And when you're cleaning it with the toothbrush, you can use warm soapy water. It doesn't have to be anything too fancy. And again, they do sell over the counter like cleansing tablets that you can also use, but it's not necessary. And then if you can go to the next slide. So there are some signs that you may need to see a dentist, especially if you're a denture patient. If you are a denture patient and you're completely edentulous, you have no teeth, the general recommendation is you come in to see a dentist at least once per year, as opposed to the traditional every 6 months. And again, that's just because there are no teeth. So really, it's more so a checkup of making sure everything is okay with the gums, if there's any sort of inflammation, as well as any just abnormalities in the tissues. But if you're noticing in a mirror that you're seeing a lot of red, it kind of looks as if it's like raw in a way. And that usually follows up with this feeling of soreness, feeling of tenderness. It may mean that your denture needs adjustments. And even if it's like a minor adjustment that takes like 5-10 minutes, it can really go a long way, especially if it's causing irritation to your tissues. So if you're seeing redness, inflammation might be a sign to make an appointment and make sure you get everything checked out. Another reason for making an appointment is if you notice that there's sorts of like white fuzz, kind of the best way that I can describe it. And it's something that if you were to use some sort of instrument or just for your finger, it can get scraped off. This more often than not means that there may be a start of a fungal infection. Fungal infections, again, can a lot of the times be caused if the dentures aren't being cleaned properly and there's not that proper care. So if you do have a start of a fungal infection or current fungal infection, then you would need to get the proper medications for that by your dentist. Okay, so why you should go to the dentist every 6 months? So it seems kind of trivial, especially, whenever I'm talking with a patient, a lot of the times I have to have a conversation with them about why it's actually important to come to a dentist, especially because in a patient's point of view, it may not seem like we're doing much. I put that in quotes. But really, when you're coming to see a dentist, we can catch things that your primary care physician or regular family physician does not see. And this is especially when it comes to things in the mouth. For example, if you have cavities or you have the start of gum disease where your gums are receding, or if you have signs of oral cancer, these manifest within the mouth. So when you're going to your primary care physician, they do like an overall comprehensive checkup, but they're not taking x-rays of teeth specifically. They're not having you open your mouth and doing a well-detailed look, well-detailed palpations to see if there's any sort of swelling. These are things that the dentist does, that we're trained to do. So we can go in ahead if, there's the start of an infection in your mouth and we're starting to see swelling or we're starting to even see some sort of crack, we're able to see that. We can also, as dentists, identify signs of conditions like diabetes or heart disease, which often have oral symptoms. So an example of this is, if there's someone who is starting to have diabetes or has diabetes that has gone unnoticed, a lot of the times when we're looking at a patient's mouth, we notice a kind of like sweet odor. It smells very sweet. And so for us, that's an indication of, okay, I think there's something going on. And so then we have, glucose kits that we can use to check your blood sugar to see what's going on, and then make the proper referral to your primary care physician to get that checked out. The other thing with that is, early detection makes treatment easier, less expensive, and more effective. So if you do have a problem with your tooth, let's say there's a cavity, if we're able to stop it in its tracks before it reaches the pulp or the nerve of the tooth, it's going to prevent you from having a lot of pain down the line. It's going to prevent you from having the start of an infection. And worst case scenario, having that tooth taken out when it didn't need to have been taken out had it been caught earlier. So I mentioned this earlier, but if you are a denture patient, and by that I mean you are completely edentulous and you have no teeth, instead of every 6 months, you can opt to visit the dentist once every year. And this is to just evaluate the fit and condition of the dentures, make sure it's fitting in properly, make sure it's not broken, it's still clean. We check for oral cancer, so we do a comprehensive examination both inside the mouth but outside of it as well, which includes all the way from your jaw to your neck area and all the way up to your temple and the back of your ears. And then alongside that, we also check to make sure there's no abnormal swellings, no abnormal lesions, and then no infections. Okay, so nutrition and its impact on your oral health. So nutrition is very, very important. And it's something that honestly, Hussein and I, and Hussein can probably agree, it's something that we never get tired of talking about to everyone, just because it really, really can prevent a lot of problems when it comes to your oral health, but as well as just overall your health as well. So, sugary foods cause cavities. So this includes obviously like candy, soda, pop, but it can also include things like chips, pasta. And by this, I mean that these types of foods have starch in them, and starch also contains sugar, sugar molecules. And the reason why we really recommend that we either stop eating sugary foods or we reduce our intake of sugary foods is because the bacteria in our mouths that cause cavities love sugar. They love the sugar molecules because that is just their source of fuel. So the more sugar molecules are introduced, the more better of an environment that there is for this bad bacteria to multiply and stay in your mouth, which can eventually lead to cavities. And so usually when we're eating food, we have our body naturally produces saliva. Whenever we eat, the amount of saliva that our body produces increases, and that's to basically create a buffer and decrease the acidity that's introduced into our mouths. So it's kind of, think of it, if you want to think about it, it's kind of like taking a sip of water, swishing it in our mouths, and just getting rid of anything that's there. It's kind of like that. So the more we snack in between meals, and by meals, I mean, between breakfast and lunch and between lunch and dinner, the more consistently and frequently we're introducing foods and we're eating and we're snacking, the less time it gives our body to produce saliva to neutralize that environment and decrease the acidity. And if there's not enough time for our body and our glands to produce saliva and compensate for that, then overall the environment in our mouth is an environment in which the bad bacteria thrives on and continues to grow. The other thing to note is acidic foods and drinks. So this includes citrus fruits, oranges, lemons, vinegar, soda, energy drinks, carbonated water. These foods and drinks are naturally acidic. And the teeth, which have enamel, it's like the first layer and it's the protective layer, these acidic foods can really wear down that enamel. And the moment that enamel is compromised and worn down, then the second layer of your tooth is exposed, which is called dentin. And when that is exposed, you are at risk for increased sensitivity. So just overall general sensitivity in your teeth and your mouth. And that's not really a pleasant feeling, especially if you're trying to eat or drink something cold or even semi-cold, and all of a sudden you feel either a jolt of sensitivity or sensitivity that kind of lingers. And also, it's just important that we have that first layer of our teeth because we want to make sure that we still have that protective layer to protect the teeth against the bad bacteria that's there. So there are several ways that we can make sure that the enamel is strong. And if the enamel is being worn down, that we can pretty much bring it back to what it was before. And that's with things like, for example, phosphorus and calcium. So eating foods that are high in proteins and nutrients, minerals, really go a long way when it comes to the strength of our teeth, because essentially our teeth are a type of bone. And so phosphorus works with calcium to basically strengthen that first layer. And you can find this in foods like meat, poultry, fish, dairy. And this makes sure that, again, that first layer is just really protected and it's healthy. You can also, it's important to eat and drink things like green tea, celery, carrots, xylitol, because these also have nutrients and minerals that allow that first layer to be strong and less likely to wear down. So now I wanted to talk about smoking. And Hussein, if you want, you can chime in whenever. But smoking is overall bad for your body, but it's also pretty bad for your oral health as well. So there's a couple effects in which smoking can cause. The first one is periodontal disease, or known as gum disease. This is when you're basically losing the bone that's holding onto your teeth. And once that bone is lost, then your gums start to recede as well, which is kind of a more common symptom that you can detect as well without being at the dentist. And once that gum disease progresses and you lose more bone that's holding the tooth, you can result in the loss of your teeth as well, regardless of how healthy and how strong that tooth is. It can also cause lesions in the mouth. So it can cause, you're at more risk for things like cold sores, sores on the tongue, on the roof of your mouth, within the cheek as well. And those can get really uncomfortable as well. And if those aren't checked out as well, they could lead to more pain and problems down the line. Another effect is oral cancer. So smoking significantly increases your likelihood of getting oral cancer. And then the final effect is tooth staining. So smoking can stain your teeth, but it can stain your teeth in a way that is very hard to remove, especially when it comes to things like regular cleanings, where if there's a superficial staining, normally we're able to get that out in regular cleanings and checkups. But the staining that smoking causes can be a little bit deeper. And so those are harder to get rid of if we're even able to. And so these are just, we wanted to include some kind of pictures just to kind of, for you all to visualize some things that you may be detecting, especially if you are a smoker. So for example, staining in that second picture. In the third picture, there's gum disease. So you can see that the gums, which is like the pink tissue, pinkish red tissue, is receding. So more of your tooth and actually the bone of your jaw is exposed, which can cause a lot of issues down the line, especially if it's a place where bacteria can seep in. And then that last picture is, an example of a lesion that is indicative of oral cancer. So 2/3 of the mouth cancer cases that are found are linked to smoking. And this also includes secondhand smoking and ex-smokers. So if you were to stop smoking, you automatically reduce your risk by 1/3. So that's all that we had for you all. And we're open for any questions or any comments by anyone that's viewing. Franco, you're muted.
Of course. I was just saying thank you so much, both of you, for this wonderful presentation. It's a great reminder of the importance of having a dentist as part of your medical team. Think of your mouth and oral health as part of your an integral part of your holistic health of a person. So that's what I'm taking away from this. And I really like the 2-2-2 rule. So I think that that's also a really good one to just keep in mind for those watching us and listening today. Two times a day brushing, 2 minutes at a time, and visit your dentist twice a year minimum. Obviously, that can vary if you have dentures. But thank you again for such a great reminder. I want to remind those that are listening that you can hit *6 to unmute yourself if you have a comment or have a question for our panelists today. I know we have a couple already from YouTube, so while the callers get ready, I will ask the first one that came through a YouTube channel is, how do you clean your teeth with an electric round toothbrush? Can you demonstrate what that would be like? And is there a preferred brand that you all would suggest?
I could go over this. So the beauty of the electric toothbrush is that it kind of does the work for you in terms of like the actual like you motioning it. So when you have a manual one, you have to kind of either like do the small circular motions, whereas the electric toothbrush, it kind of does it on its, it already does that for you. So what you're doing with an electric toothbrush, you just want to make sure you're having that same angle that you would with a manual toothbrush, and then you kind of just let it do its job. So that's the beauty of the electric toothbrush, and that's why I highly recommend it. So, and that goes for both the electric toothbrushes that are rounded or the ones that are more like rectangular shaped. So yeah, just make sure you're angling it and then just moving the electric toothbrush along. I wish I had one on me, I would have showed it, but but yeah, so you just want to make sure you're angling it and then moving it across like your teeth on the inner side, and then chewing surfaces like we mentioned as well, and then the tongue at the end.
Thank you for that. And just to clarify also, is there a preference from dentists versus those two kinds that you just mentioned, the traditional shaped toothbrush versus the round head?
I mean, every dentist will tell you something else in terms of the shape. Some will say the circular one, and some like the more rectangular one because you're getting more of the surface area of your teeth, so you're able to get more of the teeth. So honestly, it's really like personal preference for the dentist and even for the patient. I know like Sonicare has like usually they do the more rectangular shaped ones, whereas like I think Philips, I think maybe
Oral-B.
Oral-B, they do the more rounded ones, yeah. So it's really just personal preference.
Great, thank you for that. Another question that came from YouTube is, how effective is brushing with a toothbrush with flossing bristles? Are these bristles as efficient as string floss? So they're saying those toothbrushes that have those built in, I think that I'm getting the question correctly, and they can chime in via chat if that's the case, but or not the case. But those toothbrushes that have like, I think those rubberized bristles as well, incorporated into some of those hand brushes that you can buy, and I think they're advertised as brushing and flossing.
So I have not seen that or like used it personally, but I think the most important thing is the technique that you have. So not only the common question that we get is like the brand of toothbrush, but I always get asked what I recommend for brand of toothpaste as well. And so honestly, this really is just based on the preference of the patient, because the point is we want our patients, or we want people to get into the habit of brushing their teeth and getting into the habit of having the proper technique of brushing the teeth. So as Hussein was talking about, for example, making sure that you are brushing at an angle so that you're able to get the part of the tooth that is right at the edge of the gum. So it's not necessarily that, you know, I, or like Hussein, we have a preference in toothbrush. It's more so just how you're using it and how frequently you're using it. Same thing with the toothpaste. For me, I tell patients, hey, whatever brand you really like and works for you, use it as long as it has fluoride in it. Because fluoride is that important mineral that is going to help strengthen that first layer of your tooth. You know, I have a patient that, you know, at first I was like, oh yeah, you can use Crest. And then after seeing that patient, they were like, oh yeah, Crest didn't work for me. Like it just caused, they were like sensitive to it, but then they used Colgate and they were completely fine. So it really just depends on the person. Some people are more sensitive than others. As long as it has the things that it needs, and that you're able to use it properly, that's the most important one.
Thank you for clarifying. And for those listening and following us on YouTube, the angle that was referred to, again, it was in one of the charts. It's a 45-degree angle that you want to hold your toothbrush when you're brushing so that you get maximum cleaning angle for your teeth and coverage. Another question that came is, if a dentist tells you that a root canal is needed, is there anything you can do to get around that, such as some type of oral health treatment to heal the tooth?
So the goal is obviously to prevent, a root canal. So like the oral hygiene, and then if you do have a cavity that is large, try potentially getting like a filling done. But sometimes if the cavity is so large that it's reached the pulp, at that stage, it most likely will require a root canal treatment. The other option, if you really don't want to do a root canal treatment, is taking the tooth out. That's also another option. And then, once that tooth is out, there's like other replacements, such as like implants or potentially a bridge. But with root canals, there's a big misconception about root canals. People often are, really think that it's a really scary procedure, but it's actually like, honestly, once you get the numbing, the same numbing that you would get for a filling, you get the same numbing for a root canal. You don't feel a thing. So honestly, the worst part is the numbing. After that, you shouldn't feel a thing. But in terms of preventing it, like we talked about, like the oral hygiene, going to the dentist to try to maybe catch it earlier. But once it's already the cavities reach the pulp, unfortunately, at that stage, it's almost, you can't just do a filling because the pulp and the nerve are inflamed. And so it would require a root canal. If you don't want to do a root canal, then an extraction is the other option.
Great. Yeah, it's kind of what I figured when the question was brought up, but that's very helpful. Speaking of brushing, what do you suggest for an individual that can't brush while they're at work?
Good question. So I am assuming like is it like a night shift maybe type of work or like a daytime type of work? Um
Yeah,
yeah,
I'm
because
guessing that it's somebody who may not be working virtually and have to be in the space. And I guess, yeah, I would take it that route and not have a toothbrush with them.
for sure. That's a good question. So personally, like, as long as you're in, so depending on what your schedule is like, it may look differently. So, for example, if someone is working a night shift, if someone's a nurse, for example, and they're at the hospital night shift, that kind of ends up being like their quote unquote daytime. It's the time that they're active. So that in essence ends up changing in terms of what your schedule looks like. So the premise of that would be, the time that you are tuning out for the day or night and you're going to sleep, for example, whether that be during the daytime or at night, that's usually the time that we recommend for brushing teeth. And that's just because when you're sleeping, you open your mouth. Even if you're not opening your mouth, that's a significant chunk of time in which bacteria can form like a film over your teeth. And so the idea behind that is that when you're waking up, sometimes like your mouth feels kind of muddy or it feels kind of like dry. Um, the reason we brush our teeth is to get rid of that film that ended up forming over our teeth in the time that we were sleeping. This is something that's natural. It's not something that we can completely like get rid of. It's just the way that our mouths function and the way that the bacteria are in it. So I think that would just kind of look different depending on that. Now, if it's during the day, you're at work and you feel like you want to brush your teeth or you want to floss, I sometimes have, you can buy this at any store, but you can either have a separate toothbrush for that, you can just like put in your purse or your bag or whatever. And then they also have like smaller size toothbrushes as well, especially in like the travel size section. Yeah, I always have one on hand with me as well as a pack of floss. So it's easy for me to transport. It's easy for me to just put it in my pockets so people don't see what I have. And then I can just go to the bathroom or during some downtime that I have, go and brush and call it a day. I think there's also over the counter, there's the types of toothbrushes where they're meant for single use only, but they're like the moment you wet the bristles, they have like toothpaste already incorporated into it. So the moment you wet the brush and you're able to brush, it kind of foams up. There's the toothpaste already in, and so once you do that, you can just throw it out. That's also another alternative.
Thank you. So yeah, as you mentioned before, this was informative. I read that question and I was like, well, I do some of the things that you literally just mentioned. I keep a toothbrush in my desk and have floss and mouthwash. I'm not always perfect about doing it, using them when I'm in the office, like after I eat. So I think the other part that you clarified in the importance of brushing before bed and then when we wake up, as at least those twice daily, is helpful to know that there's not just one small window right as soon as I eat. So that's very helpful, hopefully, for everybody watching as well. And yeah, I guess the other one that I would add to that as well is make that new habit of just finding those alternatives, like you mentioned, the smaller toothbrush or those travel ones that you can keep in a place that is sanitary in your workplace, so you can use them when you don't have access to your own brushes at home. Obviously, this is your own brush, but not in your house. Another question is, I can't afford or I'm in a fixed income situation and I need dental care. Where can I turn for help?
So there's a lot of there's unfortunately with with dental care, we really, us, like me and Denise, I think we'd agree, like dental care we believe is a human right. But unfortunately, like dentistry, it could be expensive. And so options, to seek care that are more affordable are a dental school. So here at UIC, they have heavily discounted pricings in terms of like treatments we provide. We provide all sorts of treatments, and they provide quality treatments. We have specialists from all different fields in dentistry, so you're getting quality care, but also at a discounted price. Like for example, root canal, I think in private practice is like 1,200. Here at UIC, it's like $200, so it's much more cheaper. And then also, if that's not an option, you don't live close to a dental school, there's also FQHC, so they're called federally qualified health centers that have like a dental clinic. They also will provide treatment at a discounted rate. So those are options. A lot of times, just maybe searching online, seeing if there's any like dental clinics that do like free dental care, dental services. Like me and Denise, we work at it's called like the Refugee One Clinic, and we provide free dental treatment to refugees that have just arrived. And so if you just search on Google, you could probably come across a few. But the go-tos I would recommend is like a UIC or not UIC, but dental school that's nearby, and then a federally qualified health center.
Thank you. That's actually very helpful to know for those, again, that are watching us too. If you need care and affordability or income is a factor, then take a look at your local dental schools at universities, and also Google and see if there are places that will offer discounted rates or national programs, as you mentioned that, what was that called again?
Federally qualified health center.
Federally qualified center that will give you a discounted rate. Again, for those that are listening via phone, if you want to unmute yourself or have a question or a comment on the chat that we talked today about oral health, please hit *6 to do so. Another question that came in from YouTube is, I've seen the dental cleaning tablets for dentures. I didn't know that if they were safe. Is there an alternative besides the tablets for me to use? and brushing?
So yeah, the alternative is just using warm water and soap. And this can be any sort of, because I mean, the premise is that if you have soap at home, it's antimicrobial. So any soap that you use at home, you can just mix it with some water. You don't need too much. So maybe like for 1 cup of water, it would just be like 1 or 2 like pumps or drops. Mix that in warm water, and then you're good to go. Cleansing tablets, again, it really depends on personal preference. They're not a requirement. They're not necessary at all.
Awesome. Thank you for clarifying. Are there foods that help avoid cavities and fix enamel if I'm a vegan? That's another question. An interesting one.
Yeah, so we kind of mentioned it in the presentation. I think Denise mentioned it, like, so functional foods. So we have a professor here at UIC. She does a lot of research on functional foods. And functional foods essentially are foods that, you know, are good for your overall health, but also have like benefits like for your oral health. So like they'll prevent or rebuild remineralize enamel. They'll have like natural cleansing mechanisms. And so foods, in terms of vegan, I think I think some of the ones we mentioned on there, like celery is really good, cranberries. I think raisins as well are really good. Green tea is like another big one. So you could just kind of like search online like functional foods for oral health, and it'll like bring a whole list of like foods, and then you could search the ones that are vegan and are, you know, suit you best. But yeah, so it does like, you know, two things. It's good for your overall health and it's good for your teeth. So definitely, you know, just functional foods and you'll find a plethora of information.
Terrific, terrific. And I see a caller who's unmuted themselves. Go ahead, caller.
What about implants? How is brushing your teeth or whatever different with implants versus a denture?
Great question.
That's a good question. So with implants, it's mainly just we're in the same room, that's why sometimes it's like double. With implants, it's not a real tooth. So the main thing with that is making sure that the gum around the implant is good and healthy and not inflamed. So if you have an implant and it's next to like a regular tooth, you still want to go ahead and do like floss how you would normally floss, just for the real tooth, but also for the crown part of the implant, just to make sure if there's any sorts of food or debris that's stuck right in between the gum and the crown of that implant tooth. Flossing is going to help get that out of the way. And then the brushing is, for example, if you're brushing like the back and the front surfaces, you're essentially really just making sure that you don't have any leftover debris or plaque surrounding the edges of that crown that's right next to the gum. So for an implant, the way that you would care for it is just like how you would care for a regular tooth. It's just keeping in mind that your focus in that area is more so making sure the gums are clean and healthy, rather than the crown part of that implant.
I will add too, so a lot of times patients that have like an implant bridge, or just even like a regular bridge, the specific floss that you would use for that is something called super floss, and it kind of looks like regular floss. It just has like a threader and like a thread on the like the top of it, and you would basically thread like the bridge and then place it through and then floss right underneath. Because so with a bridge is like you have a tooth right here, tooth right here, and then in the middle it's like the fake tooth. So you want to make sure you're cleaning underneath that fake tooth, and so you're going to use super floss. So, and if you have an implant bridge, it would be essentially the same thing.
Okay, thank you.
Thanks for that question, caller. I have permanent retainers, and I use that super floss I just mentioned as well to be able to get behind my retainer that is permanently implanted behind my teeth. So that's thanks for that question. It's a good reminder for those that do have those retainers or that kind of bridge work that was just mentioned. The last question that we're going to be able to take today before our promotions is from a YouTube follower. What ingredients should be avoided in terms of erosion, such as silicone, baking soda, whitening? I have only seemed to not find these ingredients in original Colgate.
So with Denise kind of mentioned in the presentation with like the citrus food, and I actually had a patient, she came in and she had like a lot of erosion, and at first I went over the medical history. I was like, maybe she possibly has like GERD or like acid reflux. But when I asked her, she didn't have those, and so I was like, can you tell me more about your diet? I'm like, do you like any like citrus food? She's like, oh, I love lemons. She's like, I'm always she's like, and sometimes I'll use baking soda and lemons, and I'll brush with that. And that's kind of where I'm like, okay, now I see where all those like erosion is coming from. And so like with citrus food, and like Denise kind of mentioned earlier, it's going to cause erosion. It's very acidic. It lowers the pH of your saliva. It's going to cause a lot of problems. In terms of like ingredients, a lot of like toothpaste like Colgate and stuff, usually some tend to be a bit more abrasive than others. They'll have like specific ingredients. Like I know the Arms and Hammer, that one will have like baking soda. For patients that already have sensitivity, I tell them maybe avoid that type of toothbrush just because it's more abrasive and it's gonna wear that enamel more. So you could maybe stick to like a toothpaste like Sensodyne that helps a lot with sensitivity. And like other toothbrushes that don't have ingredients like baking soda or other like abrasives. So I hope I answered the question.
Yes, you did. Thank you so much for that. And again, I wanted to, is there anything else that you would like to add, Denise, in general for today's talk before we move on to our promotions?
Well, I was just going to add on to what Hussein, like the most recent one. The other thing is the toothpaste that say like whitening or have ingredients to whiten your teeth. A lot of the times, if you're interested in getting whitening, I definitely recommend either like the whitening strips or like going to your dentist and seeing that, because the whitening toothpaste usually, as Hussein was saying, has like ingredients or like particles. It's not something that we can see or we can feel, but they're small enough that essentially it just erodes or like physically wears away that enamel or like that first layer. So I always recommend to my patients not to use those types of toothpaste just because of the ingredients that it has, and that if you're interested in whitening, you can do something a little bit more like temporary, like the whitening strips, whereas toothpaste, you're using it every day. But that's all I was gonna add.
Thank you so much, both of you, for joining us today. We really appreciate this great reminder and also just new information for me as well on this important topic, our oral health. So before we say goodbye, we have a couple of promotions for our Rush Generations. We first will remind you of our next workshop, which is Learning to Live Well with Chronic Pain. It is a 6-week workshop for people living with chronic pain, and participants engage in discussions and skill-building activities to better cope with the day-to-day management of chronic pain. All sessions incorporate an exercise element and strategies for medication management, pacing activities, rest, and etc. Our next workshop will be held in person on Thursdays starting tomorrow, October 24th through December 5th from 2:30 to 5 p.m. There is still time to join, and registration will close after the second session. So don't worry. Please, if you're interested, call our 1-800-757-0202 number to register. Again, that's 1-800-752-0202 to register for Learning to Live Well with Chronic Pain. Our other is our Volunteer with Community Health Mentor Program, a key clinical component of Rush University's professional education, our IEP. The Community Health Mentor Program ensures that the future healthcare providers understand that health management and care happen mostly in the community. We are currently recruiting adults with chronic conditions to serve as mentors to hundreds of teams and students from 17 health disciplines. Community health mentors working with IPE students also receive telehealth training and a gift card stipend. Please call our 1-800-757-0202 for more information about volunteering in our Health Mentor Program. Lastly, I want to remind you all about our Shaman Senior Voices. We want to hear from you. Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and loved ones. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/shaman/collaborate-and-connect, or scan the QR code which is currently on our screen. Our next lecture, Brain Health, will be Wednesday, November 6th, again starting at 1 p.m. We look forward to seeing you all there. Thank you for joining us again.